My name is Alyssa Bass, and I'm applying to your Master's of Occupational Therapy Bridge program at ULM. I graduated from the ULM OTA program in December of 2020, and I'm currently still working on my bachelor's in psychology, but I will graduate with that in May of 2022. I found interest in occupational therapy first through the Special Olympics at my high school. I worked a lot with the special education kids there and really loved it. Thought that, this is what I want to do for the rest of my life, but also wanted a opportunity to learn new skills and possibly even, practice different settings, different populations. I really wanted to learn a lot. So that's what brought me to occupational therapy. Right after graduating from the OTA program, I got my temp license and began working at Guerrero Rehabilitation, which is an orthopedic and sports medicine clinic in Columbia, Louisiana. There I treated lots of orthopedic conditions. We treated lots of whole body injuries, so it's something that not a lot of clinics do. We had occupational therapists treating, knee injuries, hamstring injuries, things like that. A lot of lower back pain. So I learned a ton from them. I learned all about modalities, all about contraindications. I can probably still list off a ton of contraindications after a reverse total shoulder replacement. So that's knowledge that I cherish that, you can only get from on-the-job stuff. So after Guerrero, I decided I wanted to kind of try the SNF setting. So I started PRNing for a SNF company in Alexandria. And while I don't feel like it's where I belong, I love it. I cherish all my opportunities to learn there. I really love learning about assistive devices. I have implemented a ton of assistive devices that I feel have really maximized the independence among my residents. And I do say my residents, they're all my family. I love them. So I've also started a part-time job at the Autism Center in Gina, Louisiana, my hometown. I have absolutely loved it. I love all of my kiddos. I got into occupational therapy to do this, and I feel that God placed me here for a reason. This is where God wanted me to be. My kiddos range from 2 to 5 years old. All have an autism diagnosis or will be getting one shortly. So I have enjoyed learning more about, sensory processing disorders, all about introducing new tactile textures as well as oral textures, getting these kids ready for school and for life. I really want to maximize success among them and their parents, because I always think parent education is very important with autism. I believe that, if the kid's not receiving the right stimuli or right reinforcements at home, that's their life. That's their main therapy. I always refer to life as, the main therapy. I just help them along. I give them, scaffolding that they need to kind of introduce this new stuff in their life. So what makes me a qualified candidate for your program? What skills will benefit me in your program? I have always prided myself on being a quick learner. I'm very adaptable. One of the reasons that I found success in this, career is because I am so adaptable. I am willing to try anything once. I'm willing to try new treatment methods. I do tons of research to know, exactly what's going to help my patient, because care should always be patient-centered. It should always aim to maximize happiness and independence in the patient. The patient should always be able to participate in their daily occupations to the best of their abilities if I am treating them. I've always believed that, and I will continue to use that during my everyday practice. I am really good in a fast-paced environment with high pressure. I found that I thrive under pressure. I found that, when I'm juggling a lot of things, it's way easier for me to put my best effort in on all the things. So I really hope that you guys consider me for your program, and thank you for watching my video. I hope to meet you all in person one day. Thank you so much.